Skin cancer is an increasing problem in our community. In Australia, we've got the sun, we've got the outdoor life, we've got people of Caucasian or European background with fair skin, and we've got an ageing population. And so we're seeing more and more skin cancers as the years go by. And even occasionally we see it in younger people and people in their 20s and 30s. Most of these patients with skin lesions, they're referred from general practitioners who know that I do this sort of work. And of course, those patients with cancer, they're sometimes very worried about it and what its implications are. Yes, of course, we can remove those lesions, and sometimes it's just a simple cut and stitch procedure. Sometimes it requires a more advanced procedure, such as if it's a larger defect after removal of the cancer, and in those situations I need to repair the defect with a skin graft or a skin flap. In most situations, the report that comes back from the laboratory tells me that this cancer has been completely removed, and of course that's a great relief to the patient. But cancer being cancer, they can sometimes come back, so I usually put patients onto a monitoring program of seeing them every 6 to 9 months, so over a number of years, to be sure that the lesion doesn't come back. And the other thing is that some of these patients will actually develop a second primary skin cancer somewhere else in their body, which is quite unrelated to the other. So it's really good work, and it's interesting work, and it's very much within the province of a plastic surgeon. Most of the patients, when they come in for the procedure, they'll come into the operating room and I'll talk to them. I've already seen them previously for a consultation, so these cases are scheduled, but I'll talk to them again and explain what I'm going to do. I'll mark up on the part of the affected body with an indelible pen what I need to remove, and then I administer some local anaesthetic, let it sit there for a while, and then when it's numb, I'm able to proceed and remove the cancer and do whatever repair is appropriate. Patients, on the whole, are quite comfortable and not in any distress. There are a few patients who are a bit anxious, and those patients, they can be young or they can be old. They may require a little bit of intravenous sedation. And in such instances, I'll have on hand a specialist anaesthetist who can administer a sleep drug, and that makes them relaxed, and so they have no memory of the procedure. That's what we call twilight sedation. After the operation's done, the dressings are applied, we take all the patients into the recovery room, we sit them down, make them feel relaxed, give them a cup of tea or coffee, and that gives my recovery nursing staff a chance to have a chat to them, to talk to them about aftercare of the wounds, and then I can come in again and have a chat and let them know how the operation went and where we go from here. In addition to skin cancers, of course, I treat a lot of benign lesions. For instance, if a young woman's got an unsightly mole somewhere on the face in a visible position, might be growing a few hairs, it's not something that she wants, and these lesions are very nicely removed in a similar fashion, using very fine sutures so that the scarring is almost imperceptible, and these patients are very grateful for this treatment. It's good medicine and it's enjoyable medicine, and it's very satisfactory for me and the patient.